pharmacology lecture on nitric oxide. This is the second part of the lecture. First of all, we just need to understand that nitric oxide has different ways of being interacted with. Some things will donate nitric oxide, some things will scavenge the nitric oxide, which means they'll remove it out of the system. Some things will inhibit the action of nitrous oxide. And there's also these alternative methods of giving a person nitrous oxide. Also, just need to recognize, a quick review, nitrous oxide will bind to three different categories of things: metalloproteinases, there's the heme, which increases cyclic GMP. Cyclic GMP is something that causes smooth muscle to relax. It can also bind to these thiols. If it binds to a thiol, it may activate the HRAS step in causing cell proliferation, or it could inhibit G3P dehydrogenase, which is a step in the breakdown of glucose, and so that would have an effect on glucose metabolism. It can also increase the likelihood of diabetes in the case, I guess, in the case of glutathione interaction. And then lastly, if it binds to tyrosine, it can form these ONOO, which is, I guess, has something to do with the superoxide, and is involved in like breaking down different things. So yeah, it's an unstable molecule that breaks things down. And also need to understand that there are neuronal NOS, and these are three sources: neuronal, like neurons, macrophages, or like they call this inflammatory because it's mediated by inflammatory response, and there's also endothelial. Okay, so NNOS, N for neuronal, I for inflammatory, comes from macrophages, E for endothelial, eNOS. These two, eNOS and nNOS, are, I guess, stimulated activated by calcium, whereas iNOS is stimulated activated by inflammatory signals. Okay, starting over here with the donors. So this is the biggest section. These are all the, there's four ways that things can interact with nitric oxide here. So these donors, there are organic nitrates, there is nitric oxide gas, there is organic nitrite, this is organic nitrate, this is organic nitrite. There's also sodium nitroprusside, and those are the different ones here. So first of all, organic nitrate, trait, not trite, 8. So there's two of them here. There's nitroglycerin, and there is isosorbide dinitrate and isosorbide mononitrate. Okay, which I guess one nitrate versus two nitrates. So first of all, nitroglycerin. This is used commonly with people because it dilates veins and arteries. Normally, when we look at nitrous oxide, it's just going to dilate arteries, but this dilates veins, and it does it because of its effects with mitochondrial aldehyde reductase. Mitochondrial aldehyde reductase is what's responsible for the cause of dilating veins. Okay? So nitroglycerin, important, arteries and veins. What is this used for? Because it dilates arteries and veins. If somebody has hypertension, takes some nitroglycerin, it can cause their blood vessels to dilate, hypotension relieved temporarily. It can save people's lives, I guess. So it is photolyzed by light, which means that if light hits it, it can kind of break it up, make it inactive. Also, it does react with the glass and plastic tubing, so that could be a problem. Next, the isosorbide di or mononitrate. This has actually very little platelet effect, so it doesn't affect the platelets very much. But if you use it for a little while, it's going to cause some tolerance, and of course, it does the same things as other nitric oxide things, vasodilation, probably arterial. Okay, so now I'm going over here. Let's hit this one next. Organic nitrite. So the organic nitrite is, I don't know how to pronounce this, amyl, nitrite. So it has the word nitrite in it, so you know it's organic nitrite. And this is something that is inhaled. The way they inhale it is weird. Apparently they have these glass ampules. I don't know exactly how to visualize this, but apparently they crush them and then the person inhales whatever is crushed with this glass ampule, and it has its vasodilatory effects. But it's very, very short acting, so it doesn't last very long. You can't really measure whether a person gets tolerant to this, because you'd have to be like crushing them constantly for a long period of time, every 15 seconds or something. But there one thing, maybe there's no tolerance, but it's kind of hard to test that. Okay, going over here to nitric oxide gas. So what does this do? Nitric oxide gas, it's just basically they inhale some gas, that's nitric oxide. And it treats pulmonary hypotension. So if a person, should be hypertension. Yeah, that might be a mistake. Anyway, so it also treats, it should be treats pulmonary hypertension, I believe. The person's hypertensive, and it should relax it. I'm gonna have to look back on that one. And then also it treats ARDS, which is acute respiratory distress syndrome with newborns. So if there's a little kid, little baby that's born, and they're not able to breathe, maybe they're premature, and so they don't have enough of the lipid in there that's supposed to help them, then you can give them nitrous oxide and that, or NO gas, and that can help them. Going over here now, sodium nitroprusside. So sodium nitroprusside, one of the main things you need to remember about this is that apparently there's like some sort of, the prusside has cyanide somehow in it. And so when you think nitroprusside, think cyanide. And if this is part of the risk of taking it, is if a person has renal or hepatic impairment, it can cause hypotension. They can get cyanide toxicity with this as well. Those are some problems. In fact, the contraindications also have to do with cyanide. Apparently there's some cyanide in tobacco. So if somebody has tobacco amblyopia, I guess that's something you have to do with like the cyanide and cigarette smoke affecting their eyes. Maybe they can't process it properly or something. Or if they have Leber's optic atrophy, which I think also has to do with cyanide, I'm not really sure. But anyway, it's contradicted in those people because if they take it, they can die. That's a big deal. So it's very short acting. So sodium nitroprusside only works for a very short period of time. It is directly vasodilatory, it causes direct vasodilation, and also reacts with light. It seems like all these react with light as far as I can tell. So last one down here was just another category they talked about. It was the hybrid donors. And this basically what it means is that you take something like captopril and aspirin and you attach the NO to it somehow, and then you give that to them, and it's kind of like taking two pills in one, because a lot of times people that would be taking, nitric oxide would also be taking aspirin, or they'd also be taking captopril or something like that for their cardiac disease or whatever. So, but that's apparently not approved yet. So it's not used yet. Okay, so now we've talked about the donors of nitric oxide. Let's talk about the scavengers. Okay, these are things that remove nitric oxide from the system. The three here that they're talking about is heme, methylene blue, and superoxide. Okay, so superoxide apparently removes NO. These two, heme and methylene blue, apparently reverse hypotension, which makes sense because if somebody is hypotensive, meaning that their blood vessels are all expanded and they're like maybe they're going into shock or something, you give them something that removes the nitrous oxide out of their system, then their blood vessels will stop expanding and they can contract again, because remember, nitrous oxide causes blood vessels to expand. Next is the inhibitors. Okay, so this isn't that it's removing the system, but it's inhibiting its effects. So LN-MMA is used to improve hypotension. It must mean that it makes it go away, I'm assuming, since it's inhibiting it. There's also as LNAME and 7-nitroindazole and S-methylthiocitrulline. And S-methylthiocitrulline is selective for NNOS. Okay, this big word here for NNOS. Okay, now lastly we have the alternative methods of giving someone nitric oxide. For one, some people thought, well, maybe you could, apparently L-arginine is involved in the making of nitric oxide, so maybe you could just give them a bunch of L-arginine. That'll give them some nitric oxide, and it'll help their blood vessels to expand, and they can be healthy or whatever, and not have the hypertension, high blood pressure. But they did some tests with this, and it doesn't work because your body actually very carefully regulates its nitric oxide. And so taking this not only didn't do anything, but the studies that they did, the people that took it were actually more likely to die. So it didn't work. I wrote it sucks on here because it didn't work. So enhance nitric oxide downstream. So this is something that people thought, okay, so nitric oxide goes in, has these effects, and at some point in time it's going to, it's involved with this 5-phosphodiesterase, which is an enzyme that, breaks it down or whatever. So if we inhibit the 5-phosphodiesterase, then that's what breaks down the nitric oxide gas, if I'm understanding this correctly. So if we inhibit that, then the nitric oxide will stay in there longer, it'll have more of an effect, it'll have more effect in the body, even with low levels. So they invented this drug called Sildenafil. And apparently the test with the heart with Sildenafil is that it didn't really seem to have any benefit with the heart or overall hypertension. However, the Sildenafil did have, for some reason, it worked down in the penis with the vasculature to the penis and caused vasodilation, and now it's it's another name for the commonly used drug, which is erectile dysfunction medication. So Sildenafil is the medical name for it. So another thing that you can do, so first of all, they thought maybe you can put it in a diet, maybe you can enhance it downstream, which didn't work there, work somewhere else. Or maybe what we could do is just increase the bioavailability of nitric oxide. So they've got 2 drugs that do that. One thing that they did with this to increase the bioavailability is they have this drug, I don't know how to pronounce this, so I'm just going to try, ryoquigate, I don't know how to say that. But essentially what it results is increasing cyclic GMP. And one of the effects of increasing cyclic GMP is to relax smooth muscle. So relax smooth muscle, vasodilation. So ryoquigate, however the heck you pronounce that, increases the bioavailability of nitrous oxide, which results in increased cyclic GMP, which causes smooth muscles to relax, which results in vasodilation. Next, the drug here is nebivolol. So nebivolol, remember this B right here, nebivolol, followed by an I, B-I, is something that affects beta-1. It inhibits the beta-1 adrenergic receptors. So you think of this I for inhibits. You can also think of this I as a 1. So beta-1 inhibition. Well, so what happens when a beta-1 adrenergic receptor is stimulated or whatever? It is going to increase contractility, increase heart rate, all these things that cause hypertension. So if you block that, inhibit that beta-1 adrenergic receptor, then it's going to do the opposite. Decrease contractility, decreased heart rate, things that cause more hypotension rather than hypertension. So this nebivolol is used as an antihypertensive drug. And that's everything.